Hello friends, here we will be discussing two bones which are articulating, that is the first cervical vertebrae, that is the atlas, and the second cervical vertebrae, that is the axis. Here you can see these two vertebrae, a pictorial representation of these two vertebrae, the atlas above and the axis below. Now, before going into the X-ray, let us have a quick look at the diagrammatic representation of these two vertebrae. Atlas and axis are atypical cervical vertebrae. They are different from the normal cervical vertebrae what you see. What is lacking is there is no body for the atlas. If you can see here, it lacks a body. Instead, it has an anterior arch here in front. So this is a posterior view. Mind you, it's a posterior view. And here, so this is the anterior arch. The body is missing, so you have an anterior arch. And it has a good articulating process on both sides because it has to articulate with the skull, the occipital condyles of the skull here. So it has a big area to articulate with the skull. So the articulating process is kind of huge. Of course, it has a foramen transversorium, and posteriorly, posteriorly, instead of the spinous process in other vertebrae, it has an posterior arch. You can see the posterior arch here. So this is all you have to understand about the atlas. That is, it has a small anterior arch, a large, vast articulating surface, and a big and a large posterior arch. Okay, so these three things you have to understand. Now, let us look at the X-ray now. So that's the arch of the atlas. So as X-rays give you a superimposed view, we can say that is the arch of the atlas. Okay. And the anterior arch of the atlas is here, and of course the posterior arch of the atlas also can be made out little indistinctly here. So obviously the one represents the anterior arch. Okay, now you can see the two big articular processes here. Okay, here, okay, which has, so we can call it as the lateral mass of the atlas 5. Okay, this is the lateral mass of the atlas, number 5. Same as what you see here, and you have, of course, you have an articular process above and articular facet below. So 6 is the inferior articular facet. I think it's the better name is a facet than a process. So we can call the lateral mass as a process and 6 as a facet. Okay, so this is the facet. Now that's all about the atlas, and of course you can make out the transverse foramen can be hardly made out here. Okay, which is not shown here. Okay, fine. So these are the things I would like to say about the atlas. Now let us come to the axis now. Now look at the axis. Axis, as I told you, the atlas lacks a body. It is the axis which incorporates into the anterior arch of the atlas and creates a kind of body, supplements the axis or to form the body. So this is the dens of the atlas. Can you see a tooth-like process? That's odontoid process of the dens, which arises from the body of the dens and goes up all the way up to compensate for the lack of body of the atlas. Okay, so that is the odontoid process of the axis. Now let us see here, that is here. Look at the X-ray. Now can you see make out the odontoid process? So it's all similar to this. Okay, so we can make out the odontoid process of the axis. What else you can make out? Now look at this. So similar to all other cervical vertebrae, the C2, that is that the axis has a spine. So this is the spine of the axis, which you can make out here. The bifid spine of the axis 3. Okay, that's the bifid spine of the axis. And okay, the body of the axis is this. That's the body of the axis, which is not, we cannot make out the body of the axis because it is covered like with the arch of that posterior arch of the atlas here. So here you can make out the body of the axis, and what is remaining is the superior articular facet of the axis, which articulates with the inferior articular facet of the atlas. So this is and of course there is a gap. There's this articulation between the articular processes too. So you can say this is the atlantoaxial joint. So by studying an X-ray with its diagram, with a schematic picture, will always help you identify the features very clearly. Thank you.